So glad you could be with us on Living Well with Robin Stoloff. You know, many of us have experienced lots of changes with the Affordable Health Care Act, also known as ObamaCare. And here to sort through those changes is Tom Kirner, Vice President of Glenn Insurance. Thank you for joining us.
Thank you for having me.
So what are some of the positives of the Affordable Health Care Act?
Okay, one of the positives is guaranteed issue coverage, no pre-existing condition clause, and the preventative care benefits that are provided without deductible, copay, or coinsurance.
Okay, and there's always a flip side of the coin. What about some of the negatives?
It is not necessarily the most affordable health care act that you might have it been led to believe. Prices are based on age of spouse, number of children, age of children, so it can get quite expensive.
No longer is it just family coverage where they have 1 or 10 kids. It's
correct
for each child. And there are lots of new terms, some of them that we've heard before, but some that we need to sort through a little bit more. What is coinsurance? Okay.
Once someone has met a deductible, which most plans have now, then there's a cost share. Coinsurance is cost share. It might be 80-20, 60-40, 70-30. Those coinsurances give it the metallic level that Nancy Pelosi felt it should have.
Okay, the platinum or the gold or
correct
silver. And what about the deductible? Some folks have on their insurance a deductible you have to reach before anything's paid, correct?
Correct. There could be a plan. Many of them now have an upfront deductible individually of $2,000 or $2,300 per person.
Okay,
or a maximum
that was
of
our premium, but I guess
no, that's the pound of flesh before you start.
And then the max out of pocket.
Okay, then obviously once the deductible and the coinsurance take effect and you have a big claim, you can't afford 50% or 20% of a large claim. So the MOOP, or the max out of pocket, is combined. Whatever you pay in deductible, coinsurance, or copays, if you hit, let's say, normally it's a $6,000 max out of pocket, at that point it truly is a 100% coverage.
Okay, well, that is good to know. And, you know, everyone has different needs, so I guess the best thing to do would be to sit down with a professional such as yourself and talk about your needs and figure out what the best plan is for you.
Correct. And there are a lot of websites that also walk people through it, and they're good for informational purposes as well.
Sure, but the bottom line is stay healthy. It's a lot cheaper.
Oh, yeah.
Okay. Thanks so much for joining us. Tom Kirner, Vice President of Glenn Insurance, and you're listening to Living Well with Robin Stoloff on Lite Rock 96.9 WFPG.